My name is Mary Sherwin. I am 56 years old and I enjoy gardening, so this is a great time of year for me. Love the colors of the flowers and the selections of the annuals, and I love to paint. I first realized something was wrong in December of 2009. My ankle was swelling up, my left ankle, and I thought, oh, that's unusual, but maybe it's because of the work I do. I work in retail and I stand on my feet a lot, and it had been very busy that Christmas season. The swelling continued to increase. I was looking at my leg one day and I asked my daughter, does this look very large to you? My leg just feels like it's not normal. And she said, Mom, go to a doctor. So I did. I phoned to get an appointment with my doctor. I was not able to, but at our clinic in St. Mary's, there is a nurse practitioner. So she saw me. Everything for me, fortunately, happened very quickly that way. So I was sent for a CAT scan Boxing Day. So these kinds of things you do remember very well these days. So I felt fortunate that someone was able to see me and then give me the news that I had lymphoma. So in a way it was a relief to know what it was, and at the time that I received the news that I had lymphoma, I thought, well, that doesn't sound too bad. I knew it was a kind of a cancer, but I didn't realize what type of cancer, that it was a blood cancer, and how far advanced that it had progressed. So I was set up for surgery so that they could see if the lymphoma was a primary cancer or a secondary cancer, and if there was some removal, if there was a tumor, if further surgical procedure could be done. I had my surgery done the end of December, and I spent New Year's recovering in the hospital. When my family doctor knew that I would have to go for surgery, he gave me the option of going for surgery in London or in Stratford. And I didn't know. I didn't know where would the best choice be. And he assured me that if I chose to go to Stratford, I would get the best care there. He felt that I would be well looked after there. So I said yes to having surgery in Stratford. I really enjoyed my surgeon. She had a good sense of humor. She had a very reassuring manner. So going in for the surgery wasn't scary, or as scary as maybe I thought it would be. It was nice to be close to home. So my children, who are older, were able to come to Stratford in between classes. My husband, who is self-employed and has an office, was able to visit me regularly. So parking, all those sorts of little details, those weren't big details going to Stratford. So once it was determined what sort of cancer I had from the surgery, where some cells were extracted, and the surgeon was able to determine that lymphoma was the primary source of the cancer, not secondary because of something else. Then I continued on with my visits at the London Health Sciences Centre, and they determined what type of treatment I would be receiving. And there they gave me a choice. They said, you can have your chemo treatments at the Stratford Hospital, or you can come here. And I asked them, I said, well, what sort of care would I receive in Stratford for chemotherapy? I was thinking that they were the Victoria Hospital is the main hospital for diagnosing, and so that perhaps the treatment would be better there. And they assured me that they had fully trained the nurses that were in Stratford, and that it would be nice because the traveling wouldn't be as long. And I am so happy that I did say yes to going to Stratford for the care. Weather-wise, it is nicer to know that it's a 20-minute drive rather than 40 or 45 minutes, and that it is just a shorter trip, especially after the chemotherapy when you're not feeling 100%, just to be able to have a shorter drive and know that you will be home and be able to recline in your favorite chair or your sofa or your bed when you get home. My life after treatments has changed in adapting to normal life, adapting to very few medical appointments now. I see my hematologist every 6 months instead of every 3 weeks. So getting on with life, it is nice that the cancer, which was always foremost in your thoughts, in your head, now is regressing. It's more in the background.